welcome to this session on masculinities and COVID-19. What does the pandemic mean for work with men and boys? Really delighted to have you all here today. I'm going to do a few practical things and then I'll introduce myself and speakers and say a few words. So when people are speaking, I think most of you probably know by now, but if you want to click on speaker view, which is on the top right-hand corner, then you'll just see that person speaking and their slides. If you're needing translation, I'm told there's custom, if you go up to the left-hand corner and click on the little arrow next to custom live streaming service, I think Ilaria, are you also speaking in English? I think otherwise most people are speaking in English. Click on custom streaming service and you'll see view stream on custom live stream, and you should be able to go into another window that gives you an opportunity through Wordly of translating. If any problems, Jessica is very kindly being the tech wizard today, so do put a question in the chat if you need to. Okay. So I'm Nikki van der Gaag. I'm an independent gender consultant. I'm a member of MenEngage and I'm a senior fellow at Promundo, and I'm moderating this lovely panel today. Very delighted to be moderating. And we've got some great speakers. So Sandy Ruxton, who's an independent policy advisor and honorary research fellow at Durham, one of the two authors of the two reports that you'll be hearing about. And Stephen Burrell, who's the associate professor at Durham, is the other author. So they're going to be our two main speakers. But then we also have some practice-based speakers from different countries. So we have Lena Wahlqvist from MAN in Sweden, which has been working on men and boys for very many years now, and so has Lena. We have Shay Franklin from Ireland, who has also been working with men for a long time and currently works with older men. And then we have Hilario, Hilario, I've forgotten your three surnames. Hilario Saez Mendes, who's from the Fundación Internacional Social and also a member of MenEngage. So really looking forward to hearing very, very much from them about their practical examples. I'll be sharing the global report that Sandy and Stephen wrote for Promundo in the chat box a bit later on, and we will make sure that all of you get a copy of the report on MenEngage Europe that they're doing when it's finished, hopefully in the next few days, I think. So that will come out to you through MenEngage, I think, if that's all right with Jessica, so that eventually you'll have both reports together. So yes, I'm delighted to be moderating this session. I think it's really exciting new research on men, masculinities and COVID-19. And it's really interesting that it's emerging all over the world that governments are not really seeming to address gender equality in their COVID-19 responses in all sorts of different ways. And we're going to hear more detail about that from the presentations. So how can we change this? How can work with men and boys help to change this? What promising practices can we share? And what are the main challenges we're facing? We'll be very much locating this work as ever with MenEngage in a feminist context and asking things like, what does the pandemic mean for work with men and boys? How can we use the pandemic as an opportunity for progressive change? It doesn't always seem that's happening, but how can we use it as an opportunity? And for promoting gender equality as well. And I always hang on to a quote by Arundhati Roy, who's an Indian writer and activist, which I thought I'd kick off with, which says, historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It's a portal, a gateway between one world and the next. And I think the research that Sandy and Stephen are going to present and the practical examples from the other three presenters will really help us to think through what that really means. So, without further ado, I'm going to ask to share your slides, and we'll start the first presentation.
Great, thanks, Nikki. Okay, so can you see my slides now?
You want to make them big because you've still got the thing down there.
Yes, I'll, yeah, okay, great. Okay, so everyone, you can hear me and see me okay? And yeah, okay, great. Yeah, so I'll get started then. So I'm going to talk to you first of all about the report which Sandy and I wrote for Promundo, who I'm sure you've probably already heard of, based in the US, but carry out work across the world with men and boys. Yeah, so we wrote this report over the summer, just trying to look at look at the kind of evidence which has started to emerge around, how is the pandemic impacting on men and boys and masculinity issues, and we found, a whole range of different issues coming up, which I suppose are relevant for work with men and boys to take into account. And I suppose perhaps the kind of overarching finding of the report is that in all sorts of different ways, kind of masculine norms are compounding the impacts of the pandemic, both in terms of health and other kind of societal impacts as well. And the pandemic in turn is also kind of intensifying existing gender inequalities and other social inequalities as well. So there's a link to the report at the bottom there. As Nikki says, we'll share that later on as well if you want to read it in more detail. So we had 5 main kind of themes that we found as being particularly important when writing this report. The first of which was health. And of course, now, I suppose it's important to remember that over 1.3 million people have now died from COVID-19 across the globe. And in many countries, not all countries, but in many countries, it does seem that men's health has suffered particularly severely. I mean, of course, everyone has suffered from this, but it does seem that men have fared worse in many cases. Although, of course, we don't always have the sex disaggregated data to be able to identify, where there are those differences as well. Not all countries are publishing that. But so Global Health 50/50, which are kind of doing a COVID-19 data tracker based around gender. The data they've been able to kind of collect suggests that for every 10 women, 15 men are dying in confirmed COVID-19 cases. And it seems that both kind of biological and social factors are likely to be playing a role in that. For example, men being more likely to engage in kind of risk-taking behaviors like smoking or drinking alcohol might contribute to some of the comorbidities that can make COVID-19 have a more detrimental impact on people's health. But of course, at the same time, it's really important to recognize that some men are a lot more at risk than others because of kind of intersectional social inequalities. So I suppose it just shows the really important need for an intersectional approach to men's health during the COVID-19 crisis. And I suppose another key thing to bear in mind with all of this is the various ways in which, of course, all of us might be affected with kind of mental health related issues as a result of the pandemic. Including men and boys, of course. So issues like anxieties about the virus itself, or of course the loss of loved ones, or anxieties about losing loved ones, loneliness, which perhaps older men might be particularly vulnerable to, for example. Of course, the isolation which many of us are experiencing at the moment. And of course, some men and boys might struggle to reach out for support if they are experiencing these things because of those kind of masculine norms, which might, suggest that it's not manly to kind of to come across as being weak in some way, needing support in the first place. And so research also suggests, at least where that has been conducted in some contexts, that men may be less likely as well to engage in kind of various coronavirus prevention measures, whether that's social distancing or wearing a mask or engaging in hygiene practices like hand washing. And so again, I think, it's really important to look at, well, what role are kind of ideas and norms about masculinity playing in these things. So ideas about men being tough, men being invulnerable, stoical, men perhaps not engaging enough in kind of self-care. And as I said earlier, kind of risk-taking, what role might those norms be playing in some of these things, both in terms of mental health and physical health? And so the second key issue which we looked at was violence and abuse. And so, as with previous disasters and crises, the pandemic appears to have exacerbated men's violence against women and children in different countries across the world, particularly domestic abuse, with kind of victims of domestic abuse, being trapped at home with their abusers in many cases due to lockdowns, for example, but also other forms of violence as well. Like so it looks like online forms of abuse and harassment are kind of potentially increasing during this time as well. And so I suppose one thing to think about there is, what role is again, ideas about masculinity playing in all this, in the sense of, if we're seeing kind of social norms being kind of shaken up, a lot of us feeling a kind of sense of a loss of control over our lives, to what extent, in some cases, might that be heightening men's kind of motivations to try and assert or reassert a sense of kind of masculine power and control over other people? And I suppose perhaps we could see that in how it seems in many countries, cases of femicides are going up as well. And I suppose another important thing here to highlight is that, that it's really important that we do hold men to account for their behavior in this regard. So there has been a lot of focus on the, totally rightly, on the needs and the experiences of victims and survivors. But we also need to be looking at, well, why are men doing this, and how can we address their behavior? And also, that some people have been suggesting, I suppose, using language that somehow the pandemic is causing men to act in this way. But of course, most women are also being affected detrimentally by the pandemic, but aren't using violence to the same extent. So we need to look more deeply at, at holding men to account and why it is that they're choosing to use violence in this context. The third issue that we looked at was care and what the pandemic means for men's involvement in that. Of course, we've seen kind of significant increases in unpaid care demands placed on families. In many cases, it's women in particular who have been doing the bulk of that. But we have at the same time seen, many men being more present in children's lives because schools have been closed or they've been working from home more, for example. But of course, that doesn't equate to men necessarily taking on a greater share of care or housework. As I say, if women are still doing the bulk of that, even if both parties in a relationship are doing more, then that inequality is persisting. But I suppose that, it is valuable to reflect on, to what extent could the pandemic potentially bring about shifts in men's behaviours in this regard? If some men at least are becoming more involved in care or have been more involved perhaps in kind of community support or kind of mutual aid activities, could that lead to kind of some changes in masculine norms? Or will we see backward steps? If it is actually women who are having to do the bulk of this increased care, for example, is this kind of breadwinner model going to become more influential again? And as well, I suppose, it has actually been women really who have been at the forefront of responding to the pandemic in all sorts of ways, because women are do the bulk of jobs in the health and social care sector, for example, and are therefore more exposed to the virus in many cases as well. But at the same time, men have been playing a key role in, for example, maintaining essential services and playing a part in the community. So again, could that lead to some reflections about masculinity during this time? But of course, it has particularly been working class men of colour who have been doing a lot of that work and who again have been more at risk of the virus. Whether that's working in transport, for example, or retail or security or other sectors. So then the fourth issue which we looked at is, of course, the economy and how the pandemic is leading to huge crises in economies across the globe. And of course, that has huge material impacts, increasing poverty, for example, but it also has mental health impacts as well. And perhaps, for men who might be more attached to kind of breadwinner ideas of masculinity and the idea of being the provider for the whole family, that could have particular mental health implications. So there's fears about kind of suicides going up, for example, as that has happened in previous financial crises. But actually, for the most part, it has been women's jobs which have been disproportionately impacted so far by the pandemic, partly, I suppose, because of the sectors that they're more likely to work in, especially women in kind of low-paid, more labour-intensive sectors. Also, in some cases, sexist employment practices contributing to that as well. And another issue is that historically, economic recovery schemes in response to crises on this scale have tended to prioritize, male-dominated sectors of the economy, like construction, manufacturing. So I suppose that just really shows that we really need to be emphasizing the importance of valuing care and investing more in care, during and beyond this crisis, because it's shown just how important care is to our survival, I suppose, as societies. And of course, kind of making sure that, fundamentally, I suppose the current economies that we have are not sustainable in the longer term or even in the short term in terms of the environmental harm that they're doing. So we need to make sure that, the economic recoveries that governments are trying to bring in are tackling the climate crisis as well. And I suppose could we see therefore perhaps a shift in men's behavior and becoming more environmentally conscious as well and engaging in less environmentally harmful practices? I mean, at least some men might have engaged more in caring for the environment, during lockdowns, whether that's their gardens or the local area, for example. So, could that lead to shifts in men's behavior? Because it is men who, as a whole, contribute more to kind of damaging the environment in terms of things like driving or using airplanes and so on and so forth, and kind of meat eating, all sorts of different things there. And then just lastly, thinking about how governments have been responding to COVID-19. Often, they have been quite dominated by male voices, and women have been kind of marginalized in many governments. I think that's certainly the case in the UK, where I live, for example. And in some cases as well, we've seen governments take on quite kind of masculinist approaches. So, for example, minimizing the risks of COVID-19 as if, oh, we're too tough to need to worry about this, or kind of using militaristic, violent kind of wartime discourses, and also perhaps not engaging enough in international cooperation, which is so obviously vital to deal with this virus. Some governments as well have used the pandemic as an opportunity to kind of embolden the control of the state and kind of male-dominated police forces, for example, or undermine human rights and civil liberties, for example. And there's also a risk there as well, I suppose, that kind of far-right anti-feminist groups could use the pandemic as an opportunity to exploit people's kind of pain and suffering during this time, really, and to gain support for kind of xenophobic narratives and divide people in that way. So I suppose that's something which we really need to be factoring in this work. So just lastly, then, I'll just briefly introduce the survey which we conducted with 36 members of MenEngage Europe. So Sandy's going to talk about this in more detail, but there's just one question we asked there, which I just wanted to highlight, in that we asked people, to what extent they thought their government was addressing gender inequality in its COVID-19 response. And only 25% agreed that their government was doing that, whilst 56% disagreed, which I suppose is really worrying, that, governments, as Nikki pointed out earlier, are kind of doing very little really to take into account gender issues. But at the same time, it seems, at least some may be doing some things. For example, survey respondents pointed out how some steps were being taken to support victims and survivors of domestic abuse, but often, that was often an afterthought, really. It wasn't something that they'd factored in from the outset. And of course, funding typically remains very insecure for that kind of work, like support services and refuges. And at the same time, we've also seen a real lack of attention to prevention, I suppose. Of course, none of this violence and abuse is inevitable during the pandemic, but, governments haven't been doing enough to kind of recognize that and take steps to try and prevent it from happening, such as by, of course, investing in work with men and boys. So I suppose that just really underlines the need for us, all of us members of MenEngage, people who are involved in this field, need to be doing whatever we can to kind of pressure our decision makers to take into account and address gender inequality and masculinity issues as the pandemic continues, really. So I'll just a couple of quotes from the survey there, which address some of those issues. But perhaps I'll end there because I've quite possibly been talking for too long already. So I'll stop sharing my slides. Thank you very much for listening. And next it's Sandy.
Thank you very much, Stephen. And I have put the link now in the chat box. But do hold on to your questions for a little while. We're going to give you a chance to go into breakout rooms to look at all these things in more detail and to put your thoughts together as groups. So I'm going to hand over to Sandy now.
Okay, I'm just going to share my screen. Right. Well, thanks, Stephen, for going through the first report that we've done. Thanks to Nikki for the introductions. What a weird time it is. Here in the UK, last year we used to talk about Brexit. This year we talk about COVID, like the rest of you. Most of our work has been focused on that. But I wanted to start just by thanking everybody who responded to our survey, because I know it's not easy during a global pandemic to be pestering people to fill in surveys about their work and so on. But anyway, we're very glad you did, and I hope I can do justice to the responses that you gave us. I mean, clearly, I'm only going to be able to give you some headlines from the report, but as was said earlier, we will be sending out the full report very, very soon. So moving on to the survey itself, the main aim of the survey was to understand the impacts of the pandemic on work with men and boys, but we also found out quite a lot about the impacts on men and boys themselves too. This was an online survey conducted between 4th of May and 19th of June. So that period was past probably the first peak of COVID-19 in Europe in terms of mortality rates, but national lockdowns were still strict in most countries at that time. We had 36 respondents, so that's roughly a third of MenEngage Europe's membership, and from 19 countries. Most of those countries were in Western Europe or Southern Europe, also some Nordic responses as well. The missing element perhaps was Eastern Europe, but then that does reflect the fact that MenEngage Europe has fewer members in those countries, and also perhaps that there's less work of this kind going on in those countries too. In terms of the types of work, the issues that people are addressing, the target groups, I won't go into this in any detail because there isn't really time, but suffice it to say that there was quite a wide range of work that people were doing and a wide range of issues that they were focusing on. In terms of target groups, I think 53% said that they were focusing on men and boys in general, but within that, there were a substantial number who were primarily focusing on issues facing younger men and boys. On the right here, by the way, this is the cover of the new report. We only just received that yesterday, so it's still a work in progress, but that's what it's going to look like. And by the way, useful to point out that this work is supported by MenEngage Europe, and I think I'm right in saying this is the first sort of public publication that MenEngage Europe has actually had, so it's significant in that sense too. Moving on to the findings. So the first finding is fairly obvious and straightforward, really. So 64% were operating, of organisations that responded, were operating a reduced service during the time that they were surveyed. And this, of course, is at a time when many of the issues that work with men and boys addresses, so violence and abuse, health and well-being, all of these have become more urgent than ever. And yet at the same time, people were able to offer only a very reduced service. But practice varied as well. So for some, their workload increased. Perhaps those who are running counselling or online helplines. For others, they had to cancel much of their work, particularly face-to-face education, training, group work. And some people were able to move their activities online and develop some new initiatives, but that wasn't always feasible. And even where it was, some of our respondents suggested it was often a lot more challenging to actually run things online. So, for example, it's harder to build relationships. It's harder to create supportive, safe, and trusting environments for doing the work. And plus, I think it's worth mentioning that some men and boys are, of course, marginalised by the very fact of moving work online. So those who have fewer economic resources or maybe living in overcrowded housing, or haven't got the technological skills, all of them, working online is going to prove more challenging. I've introduced in my slides, by the way, some quotes from the report. I'm not going to go through those, but hopefully those will provide a little bit of colour, which illustrates some of the points that I'm making. So in terms of the obstacles that organisations encountered, and some of these are very obvious, so lockdown restrictions, social distancing, the closure of work locations where they would normally operate, difficulties with the organisations they normally work with, and gender not considered a priority. I think that's worth mentioning as well, that there is evidence that gender equality can fall off the agenda in a time of crisis, even though the inequalities can be exacerbated in such periods. So I think that's a relevant point to raise. And there are also issues for practitioners, and of course some of these would be similar to those experienced by their service users. Increased personal commitments and care responsibilities, lack of separation between work and home life, additional pressures and risks. But having said that, certainly from a staffing or a volunteer point of view, it was clear that for some there was more contact between them during the period of lockdown than there was in normal times. And of course, most of that was online. But actually, as the comment at the bottom of the page, bottom of the slide suggests, there's a paradox in there in that reaching youth is more difficult, but reaching professionals is not necessarily more difficult. And MenEngage Europe has been able to run some very successful fora over the last 6 months, where we've been, and I think we felt much more connected than we perhaps were before. So there is a paradox in there, which is perhaps worth exploring. So, second finding is around concerns around organisational survival. So many, 86% were worried about their organisation's funding. And within that, 20% were very concerned. And clearly they faced a range of issues: the inability to engage in the usual fundraising activities that they would, loss of income due to closure of programs and funding schemes, ineligibility for funding from coronavirus-related schemes, so for example, government furlough schemes perhaps. It's clear that many organisations may struggle to survive the recession brought about by the pandemic without significant and fairly rapid government support, and that could in turn contribute towards the entrenchment of gender inequality in some countries. Maybe worth saying a little bit more about the ineligibility for funding point. And one of the organisations said, well, they weren't able to apply because they were not deemed to be sufficiently essential or indeed frontline. And I think that can be a barrier for organisations like ours. The quote at the bottom there is a reminder that even before the pandemic, the survival of civil society was an issue already in some countries. So the quote is from Croatia, but perhaps Hungary is the best example of that within Europe at the present time. And also, of course, the survival of organisations working on gender equality. One of the respondents said in their response, we've always been in survival mode and we probably will continue to do so. The third finding was about supporting the feminist movement. And many organisations said they were making efforts to do this. And it was a mixture of support they were trying to provide. So some practical support, as in the quote from Kosovo there, but also some education and awareness raising about issues affecting women and girls, some signposting of victims and survivors of gender-based violence to support services, and also advocating for increased resources for women's organisations and other social services. Perhaps there is a challenge in there, though, that how do organisations that are working with men and boys act in a way which is accountable to the feminist movement when their own survival is also threatened?
And you've got another couple of minutes, just to let you know.
Fourth finding, negative impacts of COVID-19 among men and boys. I won't go through these in any detail because I think they complement what Stephen has already said. But clearly the exacerbation of violence abuse in the home is very, very significant. Increasing emotional and mental health problems, loss of livelihoods, increase in addictive behaviours. All of these feature very highly in terms of the concerns expressed by organisations. And so they cover both men's behaviour towards others, but also the direct effects on men and boys themselves. In the quote at the bottom, by the way, I mentioned the use of pornography as well. I mean, the findings weren't clear-cut about that, but clearly that's a concern with more abuse and harassment moving online as well. Okay, positive changes made by men and boys. I'll just say a little bit about this to finish off. Over 3/4 said they strongly agreed fathers were more present in children's lives. But in relation to these kinds of findings, there was a significant degree of uncertainty amongst the respondents. Several said it wasn't really possible to know what the effects of men being more present were, and the impact could be positive or negative over time. Furthermore, increased father engagement was largely enforced rather than chosen, and the finding doesn't explore what fathers have actually been doing in practice, merely that they have been more present. And having said that, clearly for some fathers there has been greater involvement in care, improved relationships, increased contribution to housework, but perhaps we need to remember the increased responsibilities on women and girls, which Stephen mentioned. And the quote at the bottom there reflects that the effects for fathers may actually vary quite a lot depending on who they are and different aspects of their identities. Okay, last slide. I just wanted to raise a couple of other issues as well, which have seemed significant in the survey. Again, Stephen mentioned this. Men and boys have contributed to community support and essential services, healthcare, emergency services, and so on. One of the respondents said they felt that men had developed a greater sense of community out of that. But I guess that's interesting. What do we mean by a greater sense of community, and what might be the sort of spillover, the positive spillover effects from that? perhaps greater empathy, greater cooperation, greater collaboration, a sense of how they connect to their community. All of those things may be positive things that we can actually build on. And the final point here, men and boys spending more time at home and less time in their peer groups, perhaps enabling some of them to open up more about their emotional lives, either to their family or to friends. And this, of course, may be a challenge to the prevailing masculine norms: stay strong, be silent, be stoical, and all of that. So I'll finish there. I just quite like this last quote, which I thought had a message not only for the people we're working with, but also for ourselves. Time to think about what is actually important in one's life. The reduction of speed is good to think about the next steps. Okay, I'll stop there and hand the baton on, I think, to Lena now.
Thanks, Sandy, and hi, everyone. Really, really nice to be here and to see both old and new friends from different parts of the world, and to have this opportunity to share some experiences from our organization and our work. And as Nikki said in the beginning, my name is Lena Wallqvist. I come from the Swedish organization Men. And just a few sentences about the organization. We are a feminist organization that has been working since 1993 with a specific focus on engaging men for gender equality and against men's violence. We have around 2,000 individual members across Sweden, and we implement a broad range of programs in Sweden, as well as in close partnerships with organizations in other countries. And in Sweden, I would say, as everywhere, the last 6 months have, of course, brought about profound changes to our society and the context in which we operate, to ourselves, to our organizations, and of course also to the work that we do. And I think for our organization, two things stood out early on in the pandemic as things we needed to address. First and foremost, as a feminist organization primarily working on the prevention of men's violence, we needed to highlight the immense risks of increased violence towards women and girls. As we know, that violence thrives in isolation, it is nurtured by stress and anxiety, etc. And since many years, we work in close partnership with the Swedish shelter movement, and there has been a strong call from their side for us to support their work, to back their initiatives, and to lobby with them for increased funding. But I would also say a call to complement the crucial work that the shelter movement does by reaching out to men with the information and awareness raising about violence and risk factors. Secondly, as an organization with prime focus on men and masculinities, we have largely centered our analysis, our focus, our efforts around, I would say, 3 issues very directly, very direct relevant to the pandemic, but also where we see particular challenges in regards to men. And I think actually, Sandy, you mentioned them all. It is parenthood and care, it is psychosocial health and well-being, and it is, again, violence and vulnerability. So just one example of things we have done that I would like to highlight here today is that we decided to carry out a national survey through the Opinion and Research Institute, Kantar SIFO, involving 1,000 fathers, to find out more about how men and fathers in Sweden experience the current situation, their well-being, their worries, their relation to their partner and children, and also how they see themselves in the role as parents. And we just received the results from this survey last week, so they are literally burning hot. Actually, they will only be launched next week, but I thought I'd highlight some interesting findings, as I think they also confirm much of what you have talked about in the previous presentations. So a first finding is that more than a third of the fathers actually say that their psychosocial well-being had deteriorated a lot in comparison to prior to the pandemic. This result clearly indicates that we need to be mindful about this, I think, especially considering that the survey was done before the current, well, whatever we call it, but the second wave of the pandemic, which is now leading to a backlash and enhanced restrictions in so many countries, including Sweden. And connected to this is the fact that a large group of these fathers have not been seeking support even when they felt the need to, not professional counseling nor support from friends or family. And the biggest reason given for this is that the fathers believe the current situation is only a temporary one, it will soon pass, etc. But I think we all know by now that it is not necessarily the case. It is also clear that some of the fathers state that even if they are very much aware that they would definitely need support, they really do not know where, with whom, or how to find it. A third result from the survey is that 1 in 5 fathers worry about their financial situation, and that this is particularly much so with young fathers. The results here, I think, also indicates that there's a correlation between experiencing economic stress and deteriorated emotional well-being that we recognize from other research, that various forms of vulnerability risk being aggravated as a result of the pandemic, reminding us that the pandemic affects us all, but it affects us differently depending on a wide range of factors and degrees of privileges in other areas. However, we also see, which also confirms what you have mentioned before, that many fathers have not in the same way been negatively affected. 57% of the fathers say that they today spend more time with their children. And when we ask this group, 86% feel that they are actually better parents. Almost 1 in 4 fathers also respond that they experience a more gender equal division of the workload in the household. And even if we know that men generally tend to have a more positive view on how gender equal the division of care and household chores actually is in reality, this, I think, is still a very promising figure. So based on this, what are some of the results and what does this mean for us in our work? And I think they confirm the importance of shared parenthood, where all parents have the opportunity to spend more time with their children and to take on and share the responsibility for children, for care and unpaid work in the household. I think it's also quite clear that it tells us that there's a need for follow-up studies as well as increased support. And even if it was only a relatively small group that talk of very severe negative changes to their emotional and mental health, I think we can see that this group is a risk group where in-depth studies would be needed. There's also recent research from the Karolinska Institute in Sweden that show that fathers who actively seek out father groups suffer more from psychosocial issues than the average father does. So with us, think that we need to be better. Those of us that do this kind of work, we need to improve our mechanisms for detecting warning signals among fathers and men that attend our activities. And we need to refine our channels for referral. And from the concrete practice, an example of things we have done is also to extend the opening hours of the online psychosocial support service that we are offering to boys and young men in the ages 10 to 20 since many years, so that it is now open also in the afternoons when kids come home from school, because schools have remained largely open in Sweden throughout this time, where we have had a 30% increase in calls already the first week of the pandemic. And this high level of increase has remained since. And what is interesting to note for us is that most of those who contact us now do not necessarily have a concrete problem they wish to talk about, but they are rather ordinary guys who are primarily bored, they are frustrated with their situation, and they are worried about their future. So actually, this has enabled us as an organization to connect with a somewhat new target group, one that we have wanted to enter into conversations with already before, but that have always been really difficult for us to reach. And as a very last point, I think that if there's one clear takeaway from being forced to do this rapid digital transformation, I think it must be that it drastically has lowered the thresholds for outreach to our target groups, but also between geographically distant places. And all of a sudden, we find ourselves being in a situation where we, for example, are able to offer new platform for engaging men in conversations on, say, sexualized violence 3 years after Me Too and issues connected to that, to offer father groups to fathers living also in remote parts of Sweden, or to have online consultations with young male perpetrators, regardless of where they live. And for MenEngage, we suddenly started to meet via Zoom to share experiences, our worries and concerns, but also ideas and support in a way we had never done before. So as a last point, I think this is just really, really interesting and challenging for us, and also positive, that even if COVID obviously has brought loneliness and isolation, it is apparent that the experience also carries the potential of bringing us closer together and to create new communities such as this one, referring back to the conclusion in your presentation, Sandy. So looking forward to continued discussion, and thank you very much.
Thank you very much, Lena. Really interesting survey. I look forward to the results of it, and also to hear those concrete examples. So, yeah, moving swiftly then from Sweden to Spain. Hilario, can we have your thoughts on the topic as well from a Spanish perspective?
Okay, thank you very much. First, I want to introduce myself. I'm Hilario from Fundación Iniciativa Social. It's a small NGO, non-profit and non-professional. So we are speaking from a situation which is quite different from the other big organizations we have in the other part in which I'm engaged at this moment, as MenEngage Iberia, which is a regional or country, as we want to name it, network that gathers Spanish and Portuguese organizations. And I'm afraid I cannot give a so evidence-based report on the situation in Spain, because we haven't had so much research being done in this time. But perhaps I could try to give you an idea of what is happening down here through my own experience in both of these organizations. On the one hand, we were, at the time we were caught with this pandemic, trying to build this network, which was being organized through a work plan we agreed in Lisbon just before the pandemic came, and where we intended to try to get the issue of men engaging on the agenda. And the reality was that it was very difficult to go on with the coordination with the actions we were planning. At the moment, we wanted to have a sort of process of participation in which inviting feminist organizations to talk about the need of developing in programs and intervention with men, and we just had to leave that because all what was supposed to be made, a meeting in Madrid or another meeting later in Sevilla, was really sort of out of the question. But on the other hand, in a very small organization like mine, we really had the impression that suddenly all the talk about the need of feminist voices speaking about a different society simply went away, and that we needed to come out and be able to link the need for more care that the pandemic brought into the debate with the feminist voices that were just before the pandemic so clear, so hegemonic in the Spanish debate. So we started with a series of meetings and programs through internet, with the Zoom and all the platforms we've been discovering in this time. And our impression was that somehow we were able to put the issue on the debate, and we are quite happy with the awareness that we've been feeling that around has been increased about the need of engaging men in different issues that have to do with the impact of the pandemic on men and the work of men. Of course, I agree that the big issue was from the beginning the link with gender violence, that also in Spain has been has seen an increasement. we are more worried with the aftermath of the confinement, because we are having the sense that while women are confined at home, men can control them better. The time that the confinement stops, there is this critical moment in which violence can be more difficult. Secondly, on the other hand, we had the impression that because of care being one of the big issues that came into the front line, at least in the first wave of the pandemic, there was also a sort of questioning of what would be men doing after this experience of domestic life and being involved. I think that there will be different ways of understanding this impact, but in the long run, I think it'll mark a structural, a different way of getting men into the caring domestic life. I had the impression that we are in a moment in which many men are discovering their responsibilities at the familiar home, at the care, and that will have a long-term impact. And of course, the focus on the only poor men, the loss of the breadwinner role, which at least here has been discussed a lot. I'm not sure about the figures you are giving about employment, but we had we had a space talking about the impact on employment. It seems that at least in Spain, the last 2 years, the last two crises, 2008 and now, are the two first crises in which the employment is not anymore the female employment, which is being more affected, but in the non-qualified sectors of men, the impact is being even greater than in some other of women. That means that we are having the impression that some sector of non-qualified working class are being really affected by this crisis, and that would be the difficult thing to work with. Are being so frustrated that they are going into this discourse of populist, reactionary, and that there is really a risk there, and it's not only a risk for gender equality, but for democracy on the whole. About what we think that we can do in this new situation, we really have grown a lot. We are now reaching out places that we could not reach because we didn't have the means to do them. We've brought all our workshops, our work in education or with men into the internet. It's difficult. It's more work for us, but I find in some funny way that many men have better access, better ability to get into this digital world, and I think we are able to get easier to men through this means. Actually, we are opening now a counseling a helpline, and I think it'll be a way of seeing how we can go on with the work in Spain. And to end, so that I don't want to take much more time, I had some notes here. I wanted to say a couple of words on the future. I share the same of the feeling of being in a historical moment and in a very difficult crossroad in which the people that are engaged in this work with gender equality, especially with men, are confronted with a really demanding moment. But I am confident on the long run. I do subscribe the words that were said at the beginning that every moment pandemics bring big changes, and I think we will be able to use this opportunity to bring to build a movement that is able to bring a majority of a social majority able to build a collaborative and egalitarian society, and I think that we will see that sooner than later. It is true that in the second wave we are feeling now the difficulties of precarious life and work, but I think that the impact of the first wave of solidarity and of the importance of caring of what is essential in life, it is really helping us to see, and I mean in this case men, that what it is really important is this non-patriarchal society we are trying to build.
Thank you, Hilario. It's really good to hear from Spain and also to hear some of your positive examples as well. Thank you very much for that. I'm conscious that we're running quite late on time. I don't want to squeeze you, Shay. Yeah, if you could make sure you keep your time reasonably limited so we have time for the groups, that would be great. And yeah, Shay, your turn next from Ireland.
I'm Shay Franklin. I'm from Ireland. I work with mostly older men like myself, and it is from that perspective that I speak. It's work that is badly funded, so we have no research, but we do have, I want to bring you a report from that edge. And I'll start by just a look at, I'm remembering a community organisation on the edge of Dublin in a very marginalised area that provides everyday access to a wide range of activities, bringing the community together, all the community, whoever and whatever their ability or their disability, whether it's physical, intellectual, mental, or neural. They're all welcome and invited to make a contribution and show themselves. And because the city owns the premises, the only service they can now offer, because the city has closed the premises, the only service they now offer is a food bank. So all of the other activities have been closed. Several hundred people who all see themselves as community workers, but that's what they are. They work to create community among themselves, are pressing their noses up against the edge. I'm remembering Maggie, and that's not her real name, a woman of my age, approaching 70, so she looks older after a lifetime of care. She's cocooning, as we describe it here in Ireland, with her son David, a man of 33 years with a mild intellectual disability. They live since April in a holiday mobile home. I see her loneliness and his missing his regular structure, which is a really important part of her life. But that is their best attempt to stay safe as two vulnerable people with what we're describing as underlying conditions. And services to people living on the edge have been dropped. So Maggie and her son are having to take care of themselves. I'm remembering my friend in a nursing home, a 6-hour round trip away from here by car, and unable to actually access the internet because of his failing sight, because of the pressure on the care staff. And I'm really struck by all of the things that we say about lockdown, cocooning, shielding and restriction really piles up on top of, as Stephen said, the masculinity that we learned as young men. So we were taught to compete and distance ourselves from others, sometimes by aggression, to be resilient, but to be self-reliant, to bounce back and to hide hurt. So what do we do in a lockdown? We retreat that bit further. And now it's official. They're telling us we have to withdraw. I'm remembering that community of old men that I'm now 80 kilometers away from them, so we can't meet. They're born and raised in the 40s and 50s, and their masculinity was formed by that time, by the zeitgeist of that time. We've been sitting together for 8 or 10 years, and so they're vulnerable physically, emotionally, and some would say spiritually. They're marginalized by their experience of migration and return. So they migrated to work in Britain in the 50s and 60s and have come back here without support networks. They're also marginalized by poverty and addiction and experience of homelessness. As a group, we've mourned members passing. Sometimes we've been the only ones at the graveside. So their restricted living is even now more restricted. Community and voluntary activities come to a dead stop, and outreach services have been discontinued. And while there are services out there, there are voluntary services. These men, I know I have described them this way myself in terms of funding proposals. They're described as hard to reach men, and they also experience the notion of finding it difficult to reach out themselves. The pubs were one of the places where they could walk in unchallenged, and they're closed. But the food bank is there, and some of those men are working as part of the food bank as volunteers. Moving online is really difficult. Access is not necessarily there automatically. It takes will, it takes energy, and it also takes the preparedness to be vulnerable online. When men that like that have to work really hard just to step into the room, but so to step into a room online is not something within their reach. So feeling secure and safe online is not something that's going to happen. For some men, they will come online, and they do come online, and they say things like, it's not the same, but it's still useful and supportive. I'm remembering in particular a group of men, and they're men doing what in Ireland we call family care. They're caring for partners, parents, siblings, or family members who are failing in one form or another. They're caring, in other words, at home. So lockdown has meant that they are isolated with the person that they're caring for. And again, they struggle not to fall back into that place of isolation in that place. Services for carers and for people living at home needing support have been curtailed. Vulnerability is heightened, and they're living with real fear for those they're caring for and for themselves in case that they bring something back into the house. They're slow to access ad hoc support because they just are unable to do that again in that hard to reach character. I hear them say it's difficult and really painful to admit the struggle to live up to their expectations of themselves in their care, their duty to be the good husband, the good son, the good brother in terms of caring for themselves, and to actually admit to themselves their resentment at that incarceration and loss of control that they have. So this pandemic has brought increased marginalization on top of poverty, addiction, and recovery. Men less able to approach ad hoc supports and less approachable to be offered support. There's also, among men that I know, increased vulnerability to slipping from the straight and narrow of sobriety as they begin to be more and more isolated. I'm really fearful about the survival of those who live on the margins, pushed further into their isolation till they can bear it no more. On the 27th of November, the Irish Statistics Office will publish the vital statistics, that's births, deaths and marriages for the second quarter of 2020. And in there will be the suicide data, and we'll know how COVID has impacted on those living on the margins. I'm remembering the steep climb that was experienced in the suicide numbers, those not able to survive the Great Recession between 2008 and 2012. The numbers just went into a steep climb. I know that I've spoken about men and their struggles, but I bring a gendered perspective to this, in how those men are on the edge. And I identify with the way they are and their struggles. Yes, it is intersectional around poverty, around sexual orientation, poverty, age, illness and addiction. Yes, women in the same situations live parallel and possibly worse lives. These are men that are at the end of their lives, and I just wanted to report on them. Thank you.
Thank you, Shay. That was just so moving. Just, yeah, really, really important perspective to remember when we're discussing all this, and really appreciate your openness and honesty with it. And yeah, hard to know what to say after that, but thank you very, very much. And I hope we're about to go into breakout groups, so I hope that with your honesty and your thoughtfulness and everybody else is interesting insights can also kind of come into the breakout rooms. So
thank you.
Hard act to follow, you always are. So we're a little bit low on time, so we thought we'd just have 15 minutes in breakout rooms, but they're going to be quite small. One of us as facilitators will try and come into each of the rooms. I'm going to post the questions in the chat box. There are three questions, and we're not expecting you in 15 minutes to answer all of them. But if you'd like to introduce yourselves, just to say your name and where you're from, and then have a look at the three questions and think about which one you'd like to answer, sorry, and so that everybody has a chance to speak just for a couple of minutes. So the three questions are: how have you adapted your work in the last 6 months? How do you see your work developing over the next 6 months? And do you know of any examples of promising practice? And we've already had, a lot of examples from different countries. So do share your own. I know there are people from a number of different countries here. We really love to hear from them. And then at the end, we're not going to have very much time for discussion, but if you could appoint someone to share at least one thing in the chat box, we can then capture that and feed that back to you later on if we don't get a chance to get to it. I'll try and pick up if there's time. So Jessica's going to be our tech wizard and put us into breakout rooms. If the facilitators could copy those questions, make sure that we know them. So how have you adapted your work, how you see your work developing, and the promising practices. We'll see you in 15 minutes time. So Jessica, over to you. Thank you very much.
Hi, Miguel. Are you there? Because if you want, I can assign you now to a breakout group. I can just do that. We want to discuss a few questions. So if you want, I can assign you now.
Hi, Jessica.
Hey.
I thought we were the same than before. Yeah, it's someone else. This is the main one, Jessica. Yeah.
This is the main room, yes.
Okay.
Nikki, I think you're muted. Are you meant to be talking to everyone now?
Yes, we are back now.
Okay, everybody's back. Thank you very much, and thank you, Jessica, very much for putting us in the rooms. I certainly had a good discussion in mine. I don't know about the rest of you. We're not so many people. We were going to ask each group to put a summary or one interesting observation into the chat box. And you're still very welcome to do that, and we'll try and capture that. But maybe what we can do is, we've only got a few minutes left, is each of the speakers might say something about the room that they were in, to finish off, and then we'll see if anybody else has put anything in the chat in the meantime. So, Lena, can I start with you? We'll start with a woman this time. Anything from your group that you want to say?
Well, I think we had Ambassador Emmanuel with us from Zimbabwe, and at the end of the discussion, I think you raised the gap that is there in terms of knowledge already prior to the pandemic, when it comes to understanding gender-based violence, to have the basic knowledge amongst authorities, to have the resources to handle this, and the systems and the structures. And of course, with those gaps, there's also increased, whatever they are in our society, I think they are the risk of being just enlarged as an effect of the pandemic. And I think this is something that goes for many countries. I think that we are now, all of us, talking about how the violence is increasing, but we know still very little about, is it increasing or not? What kind of violence? And it's very difficult to draw conclusions. In Sweden, we did a survey with municipalities, all municipalities together with the Women's Shelter Movement, on their violence preventive work. And a quarter of the municipalities said that they have clear indications that the violence is rising. But most of them would still say that we foresee increases for the future. And I think there will be lots to do in terms of analyzing perpetration of violence and effects of violence and abuse going forward. So this was something from our group, I would say.
Thank you. And Sean's just reporting from the group with Hilario and Jan as well about the frustration and anger that fuel these populist masculinist cultures, and says that we need to maintain the notion of broader thinking and understanding and the interconnectivity. I think a number of us have been talking about that, but both in terms of positive interconnectivity, but also various forms of exploitation, avoiding the unsustainable, inequitable past and reimagining a post-COVID future, and how you break down those silos of funding and action. So thank you very much, Sean, Hilario and Jan, for that. Okay, Shay, was there something from your group that you'd like to briefly report on?
Just a question about the effectiveness of online work, especially online work at the edge, where to bring, I speak about vulnerable men, but to do perpetrator work online. I wonder at the power of challenge and holding to account that can be done online, and it sits really uncomfortably with me. The ability, as I've seen in with vulnerable men, the ability to withdraw and let an online group swirl around me without engaging. So that's
a really important point, and it also spoke to your presentation earlier on, I think. So thank you. Hilario, did you want to add anything to what Sean has said, or was that covered the main point you wanted to make there?
Really, the sum up that Dit Shen was so accurate that I wouldn't add anything. It was a nice chat with Jan, and a long time I didn't see him, and I began to know new people from New York with a very good sign.
Good.
Thank you.
Oh, and I'm just going to give you the opportunity to say what you've just typed up, because that feels like an important question, and I'll hand over to Sandy and Stephen, because unfortunately we're going to have to finish then.
Okay, so I just, you'll see in the chat, I just basically, we provide support services for young fathers of all ages, parenting, education courses, and some interventions with men who have been perpetrators of domestic abuse or domestic violence. For those men we've maintained contact with during the first lockdown, now going into the second lockdown, we're not seeing the rises or repetitions of domestic abuse within our cohort, not just self-reported, but also from other agencies that work with their partners, ex-partners, and with their children. However, we are seeing increased requests for referrals for support for men from other services. So in some ways that would indicate the rise we're starting to see, and especially now the kids have gone back to school and are reporting, we're seeing the rise that we expected to see in domestic abuse numbers, but not within our own cohorts or within the cohorts of a couple of other agencies that do similar work to us. So it's interesting to know, will there be any research into the value as a preventative tool of engaging men in long-term interventions or support services, parenting education, as a means of preventing domestic abuse and domestic violence, as opposed to the wider general population who don't get it? Intervention.
Thank you. Really interesting question that we I think MenEngage and others can pick up. Sandy, Stephen, we've got a couple of minutes to wrap up. Is there anything you'd like to either report from your group or say in terms of comments on what you've heard and seen?
Yeah, I can go first if you want, Sandy. I can leave you to give a nice conclusion. But just to answer to Owen's question, actually, one of my colleagues here at Durham University, Professor Nicole Westmoreland, she's doing some research into how work with perpetrators, specifically of domestic abuse, has been affected by the pandemic and how they're responding. So if you want, I could perhaps, when she has moved forward with that, I can let you know, because that's a great question, and that would be really interesting, wouldn't it, to observe if there are differences there. And then just in terms of our group, I was in only a two-person group with Layla, but actually we talked about similar things to Shay, and it just in terms of the difficulties of doing this work online, that it is possible, but I teach at Durham University, and a lot of the students are quite middle class, and talking to them about violence and stuff, even with them it's really quite challenging, and let alone if you are dealing with more marginalized communities. Like Layla said, they would usually be doing work with men in prison, for example, and that's just difficult, if not impossible at the moment. But I suppose on the other hand, until this vaccine arrives or whatever, this is going to be what we're having to do for the foreseeable future. So I suppose, how can we develop effective ways of doing this work online is something I'm interested in, I suppose. Yeah.
Thank you. Sandy.
I was in a two-person group as well with John Ochoa, I think his name is, from Medellin in Colombia, and we had some language issues, so we weren't able to discuss very, very fully. But he clearly works for the prison service, and he's not able to work at the moment. But I think we haven't really talked about some of those sort of total institutions so much, and perhaps that is important in terms of the work. So that's one reflection. The second one is I was thinking about what Michael Flood was talking about with Alan Craig, the movement that they would like to see from less field to more movement, if you like. And I'm wondering whether we, now able to meet and talk to each other in this way, are becoming, in a sense, a movement, and what that means and how that might develop. And the third point that I just wanted to think about was clearly we have vaccines on the horizon. So what are vaccines going to mean for our work? In particular, who's going to get those vaccines is a real critical question. So clearly a lot of people are saying, well, health workers are going to get them, vulnerable older people are going to get them. But I was reading a thing from the paper yesterday saying that in France, they're looking at a much wider category of essential workers. And that will encompass potentially taxi drivers, bus drivers, people working in abattoirs, and many of those people who will get the vaccine in France, certainly, are men. So there's some interesting gender questions around who has access to the vaccine and what it then will mean for the work as well, which we haven't really touched upon, to be honest.
Thank you. I mean, I think the sign of a good session is that there are far more things to discuss than you have time for. Luckily, we have the rest of the Ubuntu Symposium. I know there's a series on backlash that's starting on December the 1st. There are a number of others next week and continuing into next year. So if you haven't, do take a look, because I think a lot of the questions that we're coming up with now are going to go on being discussed. And thank you very much to MenEngage and the Ubuntu Symposium for getting up so early and getting us online, and to Jessica as well for managing all the techie side. And I'm sorry we haven't had time to have a much longer conversation, but thank you. And also those not from Europe, so Emmanuel and John as well, and others. So thank you very much. Goodbye, and see you again at another meeting.